Thank you so much for watching. This is the presentation of the paper Web-based application for national healthcare system of Professor Padoca Calado and Professor Diquefo Fabiano from Angola. First of all, I want to enumerate some problems affecting the healthcare services in Angola and I believe many other current countries. First of all, private healthcare is unaffordable, so it's not an option for the average patient. Public healthcare is clearly insufficient for the demands. African traditional medicines are used, but do not have a regulatory framework. Pharmaceutical products are insufficient, and there is not a price or an effective quality control. It is impossible to tackle all these problems with an healthcare system, especially the cost of private health and the lack of regulatory frameworks. So we concentrate our focus in optimizing the public healthcare resources and also in controlling the pharmaceutical products. Our solution has several aspects. First of all, the workflow and data management in healthcare institutions. This is a main component and manages patients' waiting lists, patients' attendance to consultations, transfer between services, and also resources allocation. An agenda module synchronizes the services, the scheduling tasks, the meetings, and so on, and informs those involved by email or by SMS. An SMS service is used to notify consultations, reservations, interactions, and clinical observations. Another component is the dematerialized medical appointments. Another one is the control of stocks of pharmaceutical products, which integrate information about medicine stocks with the resource allocation in healthcare institutions. Another module manages blood donations, blood transfers between institutions, stocks, and priority waiting lists. The technologies we have used were Ruby, which is a dynamic and strong multi-paradigm interpreted programming language. We used it because it is a scripted language more powerful than Perl and more object-oriented than Python. Ruby supports functional or object-oriented, imperative and reflective programming, which allowed us to use distinct paradigms in order to solve different issues. Ruby on Rails application framework was used to develop the web applications, provides a fully integrated platform. We use it because it is a framework created in Ruby programming language that enables agile development and has a high productivity by writing fewer lines of code. We used also PostgreSQL, and Bootstrap. The architecture diagram shows the representation of the system where we can see users. Users access the system from web browsers and can use personal computers, mobile platforms. They can also access the system with SMS messages. For application server, we have chosen Puma, which is an enhanced version of Apache for Ruby on Rails. There are two message SMS servers. One is Telco, which offers the service that is used to guarantee the application, to use that application that sends SMS to registered users. Twilio offers the service that allows users to send SMS to the application to consult the services. Dropbox file server stores files submitted to the system. PostgreSQL database server stores the data. As main benefits, we would like to refer, first of all, patients become less dependent from a physical presence at the hospital, as they can have consultations by, for instance, telephone. Health professionals registered in the system respond to patients suggesting precautions to take, such as first aids, medication, and give other important information. Second, patients do more rational choices because they are based on credible and accurate information given by hospitals, by healthcare institutions, and also by governmental healthcare departments. These informations can be about diseases, for instance, as other up-to-date information about hospitals, pharmacies, healthcare providers. Third, healthcare institutions free some of their administrative human resources from tedious tasks as uncreated patients or records. Doctors perform teleconsultation and can follow the patient evolution quicker and easier. In times of global health crisis, are needed more than ever healthcare solutions able to inform the public, to optimize the presence of patients in healthcare facilities to those who really need to be physically present, and to facilitate the coordination between different healthcare sectors as hospitals, blood banks, the pharmaceutical sector, and governmental departments and policies. Healthcare systems contribute to improve the efficiency of healthcare services and to improve the satisfaction of stakeholders involved, mainly patients and healthcare providers.